Hi everyone, today we'll be talking about exercise and chronic disease. We'll be talking about these 5 disorders today, starting with spinal stenosis. So spinal stenosis is basically a narrowing of the spinal cavity, and often this is due to degenerative disc disease. You'll usually see this in elderly people and more often in females and people who are obese. Often you'll see these features in somebody who's walking downhill and they would have a ton of pain. So it's load dependent, and they tend to have neurogenic claudication. There are 2 treatment approaches. The first one is pretty conservative, and we try to use physiotherapy, NSAIDs, and steroid injections. The other one is more invasive, where we actually go in and do the surgery. So exercise actually is very important for the management of spinal stenosis, since this is our first intervention. And the research shows that surgical intervention is more efficacious. However, in populations, that are at risk, such as the elderly, who are also at risk for spinal stenosis, they have poorer outcomes when it comes to going through surgery. So it would be better for them to have their spinal stenosis managed by exercise. Also, it's been shown that postoperative active rehabilitation after surgery is more effective for relieving spinal stenosis. So even when you have surgery, the exercise component is really important. It's also been shown that it is important in the intervention for pain. It decreases disability, analgesic intake, depression, anger, and mood disturbance. So exercise improves spinal stenosis in 4 main ways. The first one is that the mechanical compression from lumbar flexion lordosis can be alleviated when you strengthen those muscles that help to stabilize the back. And ideally, this would relieve the spinal canal. The next way is that usually with spinal stenosis, you have compromised blood flow. And when you have compromised blood flow, you have decreased impulse conduction along the nerve roots. So when you exercise, of course, you improve blood flow to these stenose areas. And ideally, this would improve the conduction. We also talked about obesity being a main risk factor for spinal stenosis. So exercise supports maintenance of a healthy weight. And this would be a great way to make sure we reduce the risk factors for spinal stenosis. And finally, spinal stenosis is pretty painful. So exercise is a natural analgesic, and it improves mobility, quality of life, and ease of daily activities.
So I was interested in learning about exercise as a treatment for bipolar disorder. We've learned a lot about the pharmacologic treatments for this. And as far as exercise and treating mood disorders, we know that it's been really helpful in depression or other unipolar mood disorders. But specifically for bipolar disorder, some studies have been done that showing just that participation in aerobic activity for 40 minutes a week, for example, or 40 minutes a day for 5 days a week, for example, could lower depression and anxiety in these people, could improve their function, reduce their physiologic reaction to stress, and help them be more able to cope with acute stress situations. And we'll talk a little bit more about the mechanism of how this works. And so there's a few ways that exercise affects treatment of bipolar disorder. First of all is just the biologic change that is proposed to cause this effect. Aerobic exercise increases production of brain-derived neurotrophic factor from the hippocampus, which in turn just kind of increases the brain's plasticity, ability to create new connections and just be more resilient. And this decreases the effect of stress hormones. And exercise has been shown to decrease the effect of kind of the wear and tear of chronic stress on the brain. The mechanism of exactly how BDNF does this, increases neurogenesis, is unclear. But aside from these obviously kind of biologic changes we see with exercise, it's also thought that maybe just the act of the clinician working so closely with the patient to create that alliance helps the patient to kind of increase their self-efficacy, and when they master that goal, that also can help their symptoms. One caveat is that there is a potential for exacerbating manic and hypomanic symptoms in certain patients, and it just kind of comes down to the exercise that is used. It might be different for each patient, but in general, exercises like swimming, walking, or running, things with a regular cadence have more of a calming effect and more positive impact.
Okay, so I just talk about juvenile idiopathic arthritis, just because I was interested in pediatrics. And so there's a disease that manifests in childhood and it leads to joint damage. It can cause cartilage inflammation and also destroy some bone. And so, of course, it manifests in childhood, and a lot of these kids have very poor tolerance for physical activity, and so that can lead to reduced fitness, and that can cause sort of a vicious cycle, because if you can't exercise, you're going to get less healthy, you're going to gain weight, obese, and because these, like the lack of exercise causes increased traction and weight on the joints, it's going to cause the disease to get worse, which will then prevent you from actually exercising more, and so it just goes over and over and over. And so it's been a suggestion for a long time that kids with idiopathic arthritis actually exercise to help them out. There's been a lot of research on it. Exactly, 3 types of certain exercises are the ones that are approved. Aerobic, resistance, and of course yoga. The one that they do not advise is anaerobic HIIT exercises, just because there's not enough literature to actually show that it's safe, because it may lead to further joint problems in children. But a lot of studies have shown that exercise not only improves muscle strength in these kids, but also it improves in their school attendance, and it also improves in their social development. Just because they're more active, they can be running around with other kids, they can make friends, and they won't feel so left out and fall behind in their development. And so on the table, it's just a bit of things that several journals kind of suggest for certain types of exercise for people with juvenile idiopathic arthritis. For aerobic exercise, you want to have a long warm-up and cooling session just to avoid injury. You want to do a lot of weight-bearing activities, but not like free weights. You can use free weights, but you have to have like somebody there who's trained to help you out. If you do resistance training, you have to do like low to moderate intensity. And then yoga, you can do that twice a week, and that can help clear out a lot of joint stiffness that these people suffer. And these children should be followed by more than one physician, so like nutritionist, a general physician, pediatric, just to make sure that they're actually progressing and that these exercises that they do will not cause any more harm. And of course, there's some things that some contraindications that you shouldn't do exercise if you have JIA, like in febrile patients, in those who had just have an extreme relapse in the arthritis episode, or in those children that have extreme bone loss or they have extreme stenosis. You don't want to do exercise in those kids, because it's going to worsen their condition and it's not going to get any better.
Okay, so I chose to study and see if there's any relationship between schizophrenia and exercise, using exercise as kind of a treatment or adjunct treatment for schizophrenia. And it's really an emerging idea that it's quite new. There's quite a few studies in the last 5 years that have established a connection between aerobic exercise, especially, and the management of the negative symptoms of schizophrenia. So, like my colleague here was talking about, exercise releases this brain-derived neurotropic factor, which, according to one study I found, promotes synaptic plasticity and neurogenesis. And so that's potentially one of the biologic bases that can kind of explain why exercise can contribute to some slightly improved outcomes in managing schizophrenia. A single-blinded study in 2018 found that aerobic exercise can improve the severity of symptoms on a number of different metrics that they used in schizophrenia patients being concurrently treated with antipsychotics. So they're not suggesting that you treat it, with exercise alone. It's clear that antipsychotics are really the cornerstone of treatment. Antipsychotics at the moment, one study I found said that only about 60% of patients who are being treated with antipsychotics for schizophrenia actually get any symptomatic benefit from them, which really makes it clear that more research into other modalities of managing the negative symptoms of schizophrenia could be really valuable. And so this increasing evidence that exercise can contribute to the treatment of schizophrenia and a number of other psychiatric disorders, including depression and anxiety and bipolar disorder, like my colleague was talking about, really points to the potential for this to really help with schizophrenia. Next slide, please. So there is some preliminary evidence that the cognitive benefits of exercise are accompanied by neuroanatomical improvements, including increased hippocampal volume. But this is really preliminary and kind of needs to be some more research into that. A 2019 study found that exercise has positive effects on the cognitive symptoms of schizophrenia, but they are quick to point out that this is not unique to schizophrenia. It's not just schizophrenic patients who are exercising that they're experiencing these cognitive benefits. It's a lot of different, anxiety, depression, bipolar. So it's not just happening in these patients. Next slide, please. So at the moment, evidence-based guidelines really don't exist for how to add aerobic exercise into the treatment regimen for schizophrenia. The current evidence offers some support for use of exercise in concert with psychosocial interventions or diet in managing metabolic syndrome in schizophrenic patients. This is a problem that comes up frequently in patients taking atypical antipsychotics. They especially found that high-intensity interval training showed significant promise for those patients, and that management of metabolic syndrome may be one of the things that can really have a significant effect on patient mortality, because metabolic syndrome and some of the consequences of that can really contribute to the high mortality. And also the cost-benefit ratio of exercise over or with pharmacotherapy, it can be pretty inexpensive and significantly beneficial. 2016 review kind of looked at comparing the amount of exercise that patients were doing compared with the improvements that they were experiencing, and they did find kind of a real causative relationship, and they kind of were related, like the more exercise they did, the more they benefited, which was interesting to find. And significant improvements were noted in working memory, social cognition, and attention and vigilance. So what I found from all these different studies is that there does seem to be some clear evidence that exercise can have a real role in helping to manage schizophrenia, especially the negative symptoms. And I think it's clear that more research is needed into this to establish evidence-based guidelines so that it's clear how to use that when choosing a treatment regimen for patients.
Okay, I wanted to end with type 2 diabetes because it is very well recognized as a disease that is associated with lifestyle, and the disease itself is very extensively researched. So, as you all know, the basic abnormality in diabetes type 2 is insulin resistance, and this can be developed early as a part of metabolic syndrome, and really sedentary lifestyle is a risk factor for developing insulin resistance. Low level of exercise and high level of carb intake can lead to hyperglycemia, hyperlipidemia, and visceral or abdominal adiposity, which tends to cause insulin resistance. And if there's no intervention, it can progress to diabetes and all of its complications. Next slide, please. So just like lack of exercise can predispose you into type 2 diabetes, regular exercise is protective against development of insulin resistance. When you use your muscles, the acute changes are changes in the cellular intra and extracellular environments, which triggers change in protein regulations such as mitochondria and sarcomere, and also change in gene activations, both activation of the enhancers and epigenetic changes, and which, when they happen over and over for a long time, leads to an adaptation in muscle cells that leads to increase in number of mitochondria and glucose uptake transporters, which help them utilize blood sugars more efficiently and decrease the risk of insulin resistance. Next slide, please. So, in a clinical level, researchers show that significant reduction in plasma glucose can be seen on a statistically significant level as short as 8 weeks after initiation of a program, and regular exercise as well as resistance exercise are shown to have a similar effects on blood sugar level. And it is also found that when you combine aerobic and resistance exercise, you can get additional benefits. These exercises are shown to not only reduce the risk of developing insulin resistance in type 2 diabetes, they're shown to reverse some of the complications which are due to microvascular dysfunctions, and they can even reverse some of the peripheral neuropathy symptoms. So the current recommendation is to do at least 150 minutes of moderate to vigorous intensity exercise, not just walking, every week, and engage as much muscle mass as possible to induce the adaptations in the muscles. Next slide, please. So these are the references that we used. And thank you for listening.